Over 40% of seniors take prescriptions with supplements every day. Most people only focus on the individual pills. But what if the combinations they trust to stay healthy are slowly destroying their brain? Because dementia doesn't always start with aging. It often begins with interactions their doctor never warned them about. In this video, you'll discover 9 dangerous drug supplement combos that may accelerate confusion, brain fog, and even dementia, especially in seniors. Watch until the end so you can step in early and protect the people you love. Let's begin with number 1, multivitamins with polypharmacy. 4 years before his Alzheimer's diagnosis, 65-year-old Edward was on pills for blood pressure, joint pain, cholesterol, and sleep. He'd also started taking multivitamins because all his friends were doing it. At first, the changes were subtle. He began repeating errands and buying things he already had. Then came the strange moments. One morning, he was caught trying to make toast in the printer. That's the day his wife called a doctor for a cognitive evaluation, followed by the result they feared most. Research shows that taking multiple daily medications, known as polypharmacy, can overwhelm the body's ability to absorb and regulate nutrients. Adding a multivitamin on top may lead to excesses in compounds like B6, iron, or folic acid, while creating imbalances in others. This chemical overload can increase confusion, agitation, and long-term cognitive decline. No one questions a multivitamin, but when it mixes with 4 or 5 other prescriptions, even small changes can tip the brain off balance, and the damage often goes unnoticed until it's too late. If someone you love takes multiple prescriptions, talk to their doctor before adding supplements. The pills meant to help may be clouding their mind. New dementia videos daily. Feel free to subscribe. Number 2, vitamin D with statins. 3 years before her diagnosis of mixed dementia, Susan, 71, felt like she was doing everything right. Her doctor had prescribed a statin for her cholesterol, and she'd started taking vitamin D to keep her bones strong. Just like the commercial said, at first, she only seemed a little slower to respond in conversations. But over time, her energy faded and her forgetfulness grew. Then came the breaking point, when she stood in the shower for over 30 minutes, fully dressed, waiting for the water to turn on. That's when her daughter called the doctor, who ordered a full neurological workup. Studies suggest that statins, especially when taken long-term, may deplete coenzyme Q10, a compound critical for cellular energy, including in the brain. Add high doses of vitamin D, and this can further suppress natural coenzyme Q10 levels, quietly impairing brain function. The result is a slow fade in focus, memory, and energy that no one attributes to the pills. Vitamin D and statins are both considered healthy, but in combination and over time, they may drain the brain's power supply in ways families don't recognize until decline is well underway. If a loved one is on statins and supplements, fatigue and fog shouldn't be brushed off. Sometimes the cause isn't aging, it's chemical imbalance hiding in plain sight. Number 3, niacin, vitamin B3 with diabetes medications. 5 years before his Alzheimer's diagnosis, Roger, 74, was managing his type 2 diabetes with metformin, an insulin injection. One day, he started taking a niacin supplement after seeing a heart health segment on TV. It seemed harmless. His friends were taking it too. At first, he just felt more tired. Then he started looking pale, shaky, and confused during conversations. The day it all changed was when he tried to cook oatmeal in the dishwasher. That's when his wife insisted on a full evaluation. Experts confirm that niacin, especially in higher doses, can amplify the effects of diabetes medications, like metformin and insulin, leading to dangerous drops in blood sugar. For seniors, that means sudden dizziness, shakiness, confusion, and even temporary cognitive blackouts. Over time, these fluctuations can damage brain resilience and make long-term decline more likely. Niacin sounds like a helpful vitamin, and it can be. But when combined with blood sugar medications, it can turn routine moments into deeply disorienting ones. If your loved one is diabetic and supplementing for heart health, pay close attention to energy crashes and odd behavior. Sometimes it's not the disease, it's the interaction. Number 4, magnesium with diuretics. 4 years before her dementia diagnosis, 68-year-old Billy had been prescribed a diuretic for high blood pressure. Around the same time, she started taking magnesium to help with muscle cramps and sleep. At first, the combo seemed harmless, even helpful, but over time, she grew more withdrawn, often staring blankly at the wall or forgetting what she was doing halfway through a sentence. Then came the morning she called 911 over her missing dog, Chelsea, a dog that was never there. That moment finally convinced her son to schedule a full evaluation. Experts report that diuretics flush essential minerals like magnesium and potassium from the body. When seniors try to fix this by adding magnesium supplements, the balance can swing too far, especially if the body can't absorb or regulate it properly. Studies link this electrolyte imbalance to fatigue, dizziness, slowed cognition, and memory problems. The symptoms creep in slowly, often dismissed as just getting older, but the combination of fluid loss and unbalanced supplements may be quietly draining the brain's clarity. If someone you love is on a water pill and supplements, and they seem mentally off, trust your instincts. Sometimes the fix for one problem creates another where it matters most, in the mind. If any of these combinations sound familiar, don't panic. Millions of seniors take these same pills every day without knowing the risks. They're incredibly common, even recommended by many doctors. It doesn't mean you've done something wrong, but common doesn't always mean safe. Now is the time to take a closer look. Catching them early could help prevent years of confusion, decline, or regret. Let's continue to number 5, CBD supplements with benzodiazepines. 2 years before being diagnosed with Alzheimer's disease, Eugene, 77, started using CBD gummies to help him sleep after his wife passed away. His doctor had already put him on clonazepam for anxiety, and he didn't think the combination would cause any harm. At first, it helped him rest. But gradually, Eugene became more forgetful and emotionally flat. Then one evening, he wandered onto the porch in his pajamas with a suitcase, telling the neighbors he was late for a wedding. That was the day his daughter scheduled a neurological evaluation. Scientific studies show that CBD can interfere with the way the liver processes benzodiazepines, potentially increasing their potency and side effects. This combination can lead to excessive sedation, disorientation, slowed thinking, and memory lapses, all symptoms that mimic early dementia. Over time, the brain doesn't just relax. It may become dulled, disconnected, and unable to recover its rhythm. CBD is marketed as natural, but natural doesn't always mean safe, especially when paired with prescription sedatives. If your loved one uses both to take the edge off, pay close attention to mental changes, because what feels calming may be the brain slowly shutting down. Number 6, fish oil with blood thinners. 3 years before her vascular dementia diagnosis, 70-year-old Wanda was focused on protecting her heart. Her doctor had recommended daily low-dose aspirin, and she'd added a fish oil supplement. After reading it could help with memory and circulation. At first, nothing seemed wrong, but as the months passed, her forgetfulness worsened. She began repeating herself, and her sentence trailed off mid-thought. Then one day, she became disoriented in her own driveway, insisting she needed a passport to get back inside the house. Her husband, terrified, rushed her to urgent care. Findings confirm that combining omega-3 supplements with blood thinners increases the risk of internal bleeding, including in the brain. While each alone may be beneficial, together they can thin the blood too much, raising the risk of microbleeds and vascular dementia. These brain bleeds often go undetected until confusion, memory loss, or behavioral changes begin to appear. Many seniors take both thinking they're helping their heart, but in the brain, this combo may quietly be tearing down the very clarity they're trying to preserve. If someone you love is on fish oil and blood thinners, don't assume it's safe just because it's natural. Ask their doctor if it's still the right combination, especially as memory starts to slip. Number 7. Diphenhydramine with melatonin. 2 years before his Alzheimer's diagnosis, Alan, 80, had trouble sleeping. His doctor said it was normal for his age, so he started taking melatonin. When that didn't work, he added a small dose of Benadryl at night, just 1 tablet. At first, it seemed to help, but gradually, Alan became harder to wake in the morning. He stopped remembering family birthdays and started repeating the same questions in one sitting. Then came the night no one could ignore. He put on 3 coats for bed, saying he needed to beat traffic. That moment finally convinced his daughter to schedule a full evaluation, and the diagnosis confirmed what she feared most. Research shows that diphenhydramine, a common ingredient in over-the-counter sleep aids like Benadryl, is strongly linked to dementia risk due to its anticholinergic effects, which block a key brain chemical for memory. When combined with melatonin, which also slows brain activity, this double sedation can impair thinking, disrupt memory consolidation, and increase the risk of long-term cognitive decline. These are 2 of the most common sleep helpers seniors use, and few realize how powerful they become together. When the brain is sedated night after night, it may not be resting, it may be shutting down. If your loved one is using both, especially long-term, don't ignore early signs of confusion. The sleep may feel better, but the brain may be paying the price. Number 8. Calcium supplements with PPIs. 4 years before her dementia diagnosis, 69-year-old Joyce had been taking a calcium supplement every morning for her bones, and Nexium after dinner to manage her reflux. It seemed routine, but over time, she started losing track of conversations and stopped recognizing neighbors she'd known for years. The moment that broke her son's heart was when Joyce called the mailman Dad and invited him in for dinner. That's when her family realized something wasn't right and decided it was time to seek professional help. Scientific studies have shown that proton pump inhibitors, PPIs, like omeprazole and Nexium, can interfere with the body's ability to absorb calcium, magnesium, and vitamin B12, all essential for cognitive health. Combined with high doses of calcium supplements, this can lead to poor nutrient regulation, brain fatigue, and increased risk of confusion and long-term memory loss. Heartburn relief and bone support seem like smart choices, but the interaction may starve the brain of what it needs to stay sharp. If a loved one takes both daily, ask their doctor if it's still needed before the damage becomes permanent. Number 9. Iron supplements with NSAIDs. 3 years before her vascular dementia diagnosis, 75-year-old Bernice had been taking ibuprofen 800 mg daily for joint pain and an iron supplement her doctor recommended after a blood test. At first, her only complaints were indigestion and occasional lightheadedness. But then she began to lose track of conversations and confuse familiar faces. Her son brushed it off until she tried to butter a sponge, thinking it was bread. That's when the family stepped in and demanded answers. A medical study suggests that long-term use of NSAIDs can raise the risk of intestinal bleeding and inflammation, while supplemental iron may accumulate in the brain, leading to oxidative stress and faster neurodegeneration. Taken together, they may quietly impair nutrient absorption, disrupt gut-brain signaling, and contribute to confusion, fatigue, and memory issues. Pain and fatigue are common in aging, so these two are often taken side by side. But the interaction between iron overload and chronic inflammation can set the stage for silent brain damage. If someone you love takes daily pain relievers and iron, don't wait for obvious memory loss. It's the strange, quiet signs that often come first. The most dangerous combos aren't always the obvious ones. They're the daily routines. A supplement here, a pill there, quietly changing the brain. If someone you love is acting differently, don't wait, because the pills meant to help might be the reason they're slipping away.
And there you have it. What are your thoughts? Next, dive into this video for more essential tips to transform your health and help you thrive. You're going to love it. Thanks for watching Healthy End, and we'll see you there.